Good evening, everyone. Phil Penarski here with CBS 42. Now, breaking news coming out just a few moments ago. Governor Kay Ivey has announced that has declared a state of emergency for the state of Alabama due to the recent resurgence of COVID-19. She declared the state of emergency again just a few moments ago. You can find the full declaration over on our website, cbs42.com, right now, where we have all the latest information regarding the coronavirus pandemic, as well as everything the governor has said up to this point. Again, very quickly want to go over the state of emergency. It is not a mask mandate. There are no mask mandates involved in this state of emergency. There is very little actually changing to anything. The point of this state of emergency was to help cut the red tape, as the governor said in her declaration, cut the red tape so healthcare facilities can better serve the community due to the rise in COVID-19 numbers. Again, some of the key bullet points. Again, we do have everything you need to know regarding this declaration over on our website, cbs42.com, as well as over on the CBS 42 News app. It is available for free for all Android and iOS devices. Some of the key points include expanding ways healthcare can be administered in hospitals. The declaration allows for emergency rules to allow quicker licensing for out-of-state healthcare practitioners, suspend certain laws that limit the capacity of healthcare facilities, allows healthcare facilities to operate under alternative standards of care, declares healthcare workers operating under such rules as emergency management workers. So the point of the declaration was to help public health institutions maintain and battle this ongoing resurgence of COVID-19. The governor also releasing a statement on her Twitter saying that I am really proud that over the last month, Alabama has seen more than a 100% increase in COVID-19 vaccines being administered. We owe those who have gotten the vaccine a tremendous debt of gratitude. No doubt this will soon move us in the right direction, but at the current time, we also need to offer our frontline heroes, who are unfortunately treating a new wave of patients in Alabama's hospitals, a helping hand as they put it all on the line to take care of our people. That is exactly what we are doing in issuing this limited, narrowly focused state of emergency. I want to be abundantly clear. These are the words of Alabama Governor Kay Ivey, quote, "There will be absolutely no statewide mandates, closures, or the like. This state of emergency is strategically targeted at removing bureaucracy and cutting red tape wherever we can to allow our doctors, nurses, and hospital staff to treat patients that come through their doors. Let me be crystal clear. Alabama remains open for business. Alabamians do not need government telling us what to do or how to do it. Unlike last year when we were hoping for a miracle, our greatest weapon against COVID-19 today is the vaccine. So if you can, roll up your sleeve and get the shot," close quote. Again, those are the words of Alabama Governor Kay Ivey as she has just released or declared a state of emergency due to the recent resurgence of COVID-19 in the state of Alabama. She is calling this a limited, narrowly focused state of emergency. Again, for everybody wondering, there is no mask mandate in the state of Alabama at this time. In this state of emergency declaration, it is strictly to help healthcare officials and healthcare facilities better battle this COVID-19 spread. That is according to the declaration and the governor herself. Again, the governor also preaching for vaccinations, pleading with residents to get vaccinated, saying that the state has seen a spike in vaccinations recently. We also heard that from State Health Officer Dr. Scott Harris yesterday in his COVID-19 briefing as he announced all the latest numbers. Again, one key point, though, that she did mention in the state of emergency is the limited space right now. Right now in the state of Alabama, 95% of all ICU beds are currently being taken up. That is why she declared the state of emergency, saying that this will allow healthcare facilities and doctors and nurses better combat the virus. Again, we will stay on top of this story coming up in under a minute on the CBS 42 News at 5. We will have the latest on this, as well as over on our website, cbs42.com. And also on our website, if you click on our coronavirus update tab right there on the home banner, you will be able to find all the latest information regarding the coronavirus pandemic as it in regards to the state, Jefferson County, and the country as a whole. Again, the CDC also recommending booster doses of the vaccine to those who are immunocompromised. That is coming out as new today as well. So again, head on over to our website, CBS42.com, where you can find all the latest information. Thank you all so much for joining us today on CBS 42 Now. And again, coming up right now is the CBS 42 News at 5 check-in for the latest developments on this state of emergency being declared by Governor Kay Ivey. I'm Phil Panarski, and thank you all so much for watching us today.